Hi, this is Louis from ndxsexting.com, the channel where we try to provide you with healthcare solutions and bring you diagnostic information so you and your family could stay healthy. Now, in today's video, we're going to discuss peripheral neuropathy. Now, what is peripheral neuropathy? Well, in basic terms, it just means when multiple nerves are affected. And usually you get tingling and numbness on the feet. So it affects the lower extremities first. It starts on the feet. Now, if you don't take care of it, it can progress into your hands. But it usually starts on the feet, on the plantar. Usually when you start walking, you feel some numbness and you feel some tingling. Enough where you want to go to a doctor to find out exactly what's going on. Now, and you can have mild to moderate to severe cases. Obviously, it starts mild, then if you don't take care of it, it starts progressively getting into moderate, and then severe. And in severe cases, you can feel pain. Now, obviously, you want to go to a neurologist, or at least the main doctors that would be able to diagnose peripheral neuropathy would be a neurologist or a physiatrist. But when you go to a regular internist, I had a follow-up with my internist, and he was telling me, not mention the name of the patient, but since I do nerve examinations, my specialty is the peripheral nervous system, which is nerves and muscles. He was telling me about a patient that he saw that had really advanced peripheral neuropathy. He didn't know why this patient ended up having such a severe case. He didn't really see this patient before, but obviously you never wanted to get that bad. You want to be able to take care of it. And he was just telling me that he was going to send the patient to a neurologist, and then that way the neurologist could do a neurological examination. So if you go to a neurologist or a physiatrist, those are the main two doctors. But like I said, an internist could diagnose peripheral neuropathy, and obviously you have to follow up with a specialist, because then you're going to need some tests in order to be able to document these clinical findings and these symptoms. So a neurologist will be able to test your motor nerves and your sensory nerves, are the two main nerves that get affected when it comes to peripheral neuropathy, and they'll establish a clinical diagnosis. And one of the main exams that you need, right, for this type of neuropathy, it's a nerve examination. Now, that's what I do. Okay, so I've seen hundreds of patients with peripheral neuropathy, or when multiple nerves are affected. And one of the questions that I ask, of course, is how did it develop? What is the root cause of peripheral neuropathy? And how can you avoid that? And this is what this channel is for. This channel is not to just give you information about peripheral neuropathy and perhaps maybe take medication to take care of it. No, it's get into the root cause, why you developed this neuropathy, and how could you avoid it. That way, when we get older, or we start to get older, what's the objective? It's to be healthy, to be able to avoid disease. And obviously, sometimes disease befalls upon all of us, and there's nothing that we can do. In fact, one of the doctors that I work with, she was telling me that one of her associates, eats healthy, exercise, good weight according to body structure, never eats nothing bad, and caught cancer. There was no explanation why that patient caught cancer. Now, that can happen to any of us. And there's some things that we can avoid. But a lot of the disease that we have today are self-induced. So it's important that we learn how to take care of our bodies. Okay? Take care of ourselves, take care of our minds, take care of our nerves and muscles. The body is composed of two major highways, I always like to tell my patients: the peripheral nervous system, which is the nerves and muscles, and the cardiovascular system, which is your arteries and veins. We need to keep those two healthy. And obviously there's more, but in today's video we're going to discuss just basic components. Okay, so the nerve examination, when we do a nerve study on a patient that has peripheral neuropathy, or has at least the symptoms of it. I mean, sometimes it could be very mild, sometimes it could be borderline normal, and sometimes it could be pretty bad. Now, we need to avoid getting it pretty bad. So that's why we're making this video, to kind of give you information and give you preventive measures. Now, you can get peripheral neuropathy. You can get into an accident. I just had a patient recently. He had an accident a long time ago where his legs were run over. Okay? And what happened? Well, now he had another accident. That's why we ended up seeing him. And he had multiple surgeries on his legs. And obviously he has atrophy now. Okay, some muscles that are supposed to be there are not there. And when we did a nerve study on him, we were able to tell that multiple nerves were affected. Well, this patient has peripheral neuropathy, but his health is good. He's a good weight, young kid, like 25 years old, but he got into an accident when he was about 20. So accidents, we can get into accidents and we can develop nerves that get affected because of these accidents. There's many accidents, we're not going to get into that. But also there's disease. Okay? Diabetes is one of the main reasons people get multiple nerves affected. Cancer, the chemotherapy affects the nerves. HIV, okay, disease. You got rheumatoid arthritis, that it can affect multiple nerves. And you have alcoholic neuropathy. There's many diseases, but I'm going to mention just the major ones. What number one is diabetes. We're going to get to that in a second. But let me just tell you a brief story. I had a patient years ago. Doctor told me, listen, it's clinical symptoms of tingling and numbness on the feet, on the hands, but predominantly the feet. And the patient has been diabetic for 5 years. Okay, no problem. Young guy, looked at his history, slim. He was about maybe 40-something years old. And this is back in 2007, 2008. But when I started doing a nerve examination on him, I started noticing that he was not feeling the electrical impulses. Now, when we do nerve studies, we start with the intensity at 0. We increase the intensity until the patient feels it, and then we increase the intensity until the nerve responds. And you want to know more about how nerve examinations are performed, how they feel, then I got tons of videos when it comes to nerve studies and when it comes to EMG studies. So you can go into my channel, you can subscribe to the channel, and every time I take out a video, then you're going to be the first one to receive a notification. But I have tons of information when it comes to EMG and nerve studies if you want to know a little bit about that. So anyway, this patient had multiple nerves that were affected. I'm like, hold up a second. Diabetes for 5 years? He's slim. He looks okay. It doesn't make sense. And when I said that the nerves were affected, they were severely affected. Okay, so he had a severe case of peripheral neuropathy. All nerves were affected. And some of them were not even obtainable, meaning there was no response. So something else was going on here. So at the end of the exam, I asked them, like, listen, doctor says you have diabetes for 5 years and you have the symptoms, but your situation is a little bit too advanced. This does not happen in the last 5 years. Something's going on here that you're not telling the doctor, or you're not telling us. He said, oh, no, nothing. I'm like, okay. So eventually, obviously, he caved in. So he's an alcoholic. Okay. How long? 20 years. So this patient, this gentleman, has been getting drunk for 20 years, every single day of his life. He wasn't drunk at that particular moment, but he was going to get drunk later. So you have alcoholic neuropathy. So if you drink alcohol excessively, and if you're the type of person that gets drunk, you could develop peripheral neuropathy. Okay? Where multiple nerves are affected. And you do not want to have this type of neuropathy because it can really be painful. It could be aggravating. And obviously, I did not see the patient again. I don't know if that could be reversed. You can reverse that because it's so advanced. But it wasn't the diabetes that was causing it. Obviously, the diabetes did not help. But I'm just giving you an example of alcohol. So if you're the type of person that drinks, maybe you need to tone it down a little bit. It's about using preventive measures, taking care of our health, learning about our bodies. Nothing wrong with drinking, but we need to drink in moderation. But getting drunk, it affects our bodies. We could make many mistakes if we are impaired. So getting drunk is definitely a no-no. That's intoxicating our bodies, and that's definitely not. But we can drink, have a wine, a couple of glasses of wine. You know what your tolerance is. At home, maybe we can drink a little bit more, but in moderation. That's it. Enjoy the alcohol. Don't overdo it. Same thing with eating. Don't overeat because it has consequences to our health. Okay? But anyway, so let's discuss the main cause of peripheral neuropathy. What is the main cause? The main cause is diabetes. It says about 40 million people in the United States have diabetes. And those are the ones that are counted for. There has to be another 10, 15 million people that are not counted for. So let's just say, let's just go with a good round number, which I believe it could be about 50 million people with diabetes in this country. That's a lot of people. Now, from diabetes comes many diseases, but we're going to discuss peripheral neuropathy in this particular case. So usually you go to the doctor, you have multiple nerves that are affected, and then you get diagnosed with diabetes, and you have diabetic peripheral neuropathy. And then what happens? They'll give you some medication, you treat it, maybe you have to get on some sort of diet, and that's it. But we need to understand now how to use preventive measures. How do 40 million people, 50 million, 35 people, no matter what the number is, end up with diabetes? That's a huge number. That is a lot of people. And a lot of the diabetic patients that I have seen, and over the years, it's self-induced diabetes. They've done it to themselves. Okay? So in turn, peripheral neuropathy is caused by diabetes, and diabetes is caused by your poor nutrition because of what we eat. So if we can just learn how to eat a little bit better, we could avoid diabetes. If we could avoid diabetes, we could avoid peripheral neuropathy. But diabetes just doesn't cause peripheral neuropathy, it affects your cardiovascular system. We mentioned before, two superhighways, right? Peripheral neuropathy, peripheral nervous system, nerves and muscles. Diabetes affects your nerves and muscles. And then we have cardiovascular system, arteries and veins. Well, diabetes affects your arteries and veins. Why would you want to intoxicate your body with bad nutrition and have this disease develop later on? To me, it just doesn't make sense. Now, I have a couple of friends that just were diagnosed with high cholesterol. These kids are 38 years old. And when you're 38 years old, there's no reason for you to have high cholesterol. When you get 38 years old, there's no reason for you to be overweight because you're doing it to yourself. Unless, obviously, you have a thyroid problem, you have other medical conditions. If you have a medical condition and you're overweight, if you have high cholesterol, whatever the situation might be, then listen, that's a whole different story. But we're talking about things that we do to ourselves. Now, I discuss with my friends, about what they eat. And you got fast food. That's definitely no-no. It does not mean that you can never eat fast food. I mean, I have McDonald's every now and then. But usually when I have McDonald's, what I try to do the same day or the day after, I drink green tea afterwards. Kind of just get that thing out of your system. Now, really quick, there's a big difference between a regular hamburger and a McDonald's burger. Now, if you get a regular hamburger and you cook a regular hamburger and you leave it out, and you take a McDonald's burger and you leave it out, and you come back in a month from now, the regular hamburger, it's gone. Okay? Worms, all kinds of stuff. It dissolves. The McDonald's hamburger is preserved. So that means when you put that into your system, unless you get it out, it's going to stay there. So when you eat McDonald's, you have to know that that stuff is going to be in your body for a very long time. You got to get it out of there. Green tea is good to get those type of foods out of your system. Also, when you wake up in the morning, maybe warm water with lime or lemon, it's good to get that out of your system. So when we eat bad foods, I usually I do these things. Obviously, drink plenty of water. But what happens is that's only when you do it sometimes. But what happens if you eat fast food on a regular basis, on a weekly basis? That's not good. So fast food, canned food, frozen foods are the three ingredients that can get you extremely sick. Okay? Very, very bad. You do not want to have that on your diet. But listen, every now and then in my household, we buy like DiGiorno's frozen pizza. But it has a lot of sodium. So we might buy it like once a year, twice a year at the most. During the pandemic, we bought canned food, and because you need to have canned food sometimes if it's an emergency, but we don't eat canned food, not in my household. Now, for instance, let's just talk about beans for a second. Like, a lot of people like beans. Latinos like beans. All people like beans. Beans are healthy. But there's a huge difference, and I should have got a can of beans. But there's a huge difference between a regular can of beans. A regular can of beans has 400 grams of sodium. Now, Doritos are not good for you. It has a lot of sodium. If you keep on eating a lot of Doritos, it's bad for you, right? Now, Doritos has 150 grams of sodium. Beans has 400. Now, what happens when people cook it? The majority of people cook the canned beans and they put a little bit more salt in it, more sodium. So if you eat that on a constant basis, it's not good for you. So canned beans are not good for you. Just read the ingredients in the back. Now, you know how much sodium the bag of beans have? I think it's either 0 or 5 milligrams. Nothing. When you cook it, obviously it takes a little longer, but all you have to do is, I tell my friends, sometimes even their wives, they consult with me for advice. Just put them in water. And then the next day you cook them. You can cook them in 45 minutes once they're soft. Sometimes I think my wife's mother, she puts a little vinegar, and then that kind of softens up the beans a little bit. And then you make a lot. You can make for 2-3 days. But it's a big difference when you eat regular beans, canned beans. Canned beans is bad for your health. It makes you gain weight. In the long run, it's not going to be good for your health. You could develop cardiovascular disease, diabetes, high blood pressure, all kinds of stuff, just because you eat bad. Now, beans is just an example that I am giving you because so many people consume canned food. Canned food, when I was growing up, my mother didn't really buy any canned food. Sometimes she'd buy like maybe a can on corn in the can, but barely. And then the fast food was not as much as we have now. So we didn't really consume any fast food. We didn't consume any canned food, and we didn't consume any frozen food either because my mother was old school. Everything was fresh. So diabetes, it's because if we get diabetes, it's because we are making poor choices on nutrition. But if we can take the last 3 that I just mentioned, then that could definitely help you with your diabetes. So that's the most important thing. If you don't want to end up with peripheral neuropathy, you have to kind of delete or get rid of the number one cause causing peripheral neuropathy, which is diabetes. Don't end up with diabetes. If you don't end up with diabetes, you can take care of your health. So this channel, we're going to provide good healthcare solutions. We're going to give you a lot of diagnostic information when it comes to taking care of your health. And I'm going to discuss some of the things that I do, how I take care of my health, and it's important. Okay, I'm 52 years old. I've been doing nerve examinations. My specialty, it's electrodiagnostic medicine. My specialty is the peripheral nervous system, which is nerves and muscles. And I have family members. They are into they do ultrasound. They concentrate on the cardiovascular system. So I have a lot of knowledge of how to take care of our bodies. And one of the things that I do with my household, with my wife and my kids, take care of ourselves. Use preventive measures so we can be healthy. So we're going to bring you a lot of videos. This is a brand new channel where we're going to provide you with healthcare solutions. We're going to give you diagnostic information at all levels. How to take care of your skin, how to take care of your hair, how to take care of your posture, how to take care of your body, how to have proper weight for your body structure. Okay, how to learn about different types of medical components. Okay, how to use medical tools so you can take care of yourself. We're going to discuss a lot in this channel. This is going to be broad but narrow at the same time that we're going to discuss key things, basic things that we could do every day in our lives so we could be healthy. There's nothing better. Usually you start worrying about age once you pass 40. I mean, I'm 52 now, so when I was 40 years old, I didn't really think I would consider myself young. Once I hit 45, then I knew that things are changing a little bit. Okay, but if we could take care of our bodies, we could be 60 years old, good body structure, good weight, good posture, hair, whether you're a male or a woman, good skin, and look perfectly healthy, and moving forward to live a long, prosperous life. And now this is what this channel is going to be about. So if you like this information, please prescribe. Subscribe. I'm already thinking about medication. I'm not prescribing anything. Subscribe to our channel, and that way you can turn on your notifications. You can receive or know once I take out my next video. If you find this video helpful, please share it with your friends. This is a new channel. We're going to do our best to make you healthy at a basic level, because what happens is, and the truth of the matter is, when you go to a doctor, when you go to your doctor, they have limited time to be able to sit with you and explain things to you. It's your job to go out there, okay? Stay healthy, so when you go to the doctor, you do your basic checkups. You're not going to have any issues or any problems. Then later on, taking medication, you got to do all these things because you did not take care of your health. Take care of your weight and do what you need to do. I'll see you in the next video. Bye-bye.